Well, as many of you know, I'm not usually at a loss for words, but finding the right words tonight to convey my deep admiration and respect for our first honoree was not easy. Darrell Kirch is not only a friend and a colleague, he really is a true icon of American medicine. Darrell received his MD degree and his psychiatric training, postgraduate training in psychiatry at the University of Colorado in his hometown of Denver. His decades-long career has included groundbreaking research in neuropsychiatric disorders at the NIH, and he also spent some time as the acting scientific director of the National Institute of Mental Health. He went on to serve as dean not just of one, but of two medical schools, first at the Medical College of Georgia, and then at Penn State College of Medicine. He was elected to the National Academy of Medicine in 2007, and in 2014, he was named a Distinguished Life Fellow of the American Psychiatric Association. Even more notable, from my point of view, he was named, as you just heard, my successor as president of the Association of American Medical Colleges in 2006. Now, in all modesty, I thought I had done a pretty good job as president of the AAMC. But then along came Darrell, and he showed the world how that job could really be done. As many of you know, the AAMC represents all of academic medicine, which comprises all 151 U.S. medical schools, some 400 of the country's teaching hospitals, as well as thousands of their faculty, residents, and their students. Over the past 12 years, Darrell has led that complex organization to unprecedented heights. On the inside, he has refashioned and modernized the entire governance structure of the association and built a stunning new headquarters building to house its outstanding Washington, D.C. staff. On the outside, his wise counsel and passionate devotion to professional values has enabled academic medicine through his leadership to maintain its bearings through what I would think is some of the most challenging times it has ever faced. A short list of those challenges would include the avalanche of new medical schools vying for accreditation, fundamental rethinking of the very processes and content of medical education, including the seamless incorporation of nurses and other healthcare professionals in the preparation of effective multidisciplinary teams of healthcare professionals, the preparation of effective, a mounting level of stress, both financial and emotional, in the learning environments that are essential for quality education, and urgent calls for public accountability to address insufficient diversity of the physician workforce, persistent geographic maldistribution of the healthcare providers, unrelenting rise of student debt, and certainly not least, sustaining the profession's commitment to the highest standards of humanistic, medical, and compassionate care. Through all this, Darrell has been an unflinching partner in pursuing the mission of the Arnold P. Gold Foundation. Acknowledging his longtime support and friendship, as you heard earlier, Sandra called on Darrell to deliver one of the eulogies at Arnold's funeral last January. Tonight, we are most pleased and most grateful to honor Darrell Kirch with the National Humanism and Medicine Medal. Darrell, could you come up? The medal reads, The medal reads, "For a lifetime of service to American medicine and courageous and exceptional leadership in advancing medical education and the cause of humanism in medicine." Darrell, congratulations.
This absolutely has to be one of these times when I should quit while I'm ahead. But I have to thank Jordan for an introduction that was far too kind. You know, those broad shoulders, I'm reminded every day that I stand on them, and that academic medicine is where it is today because of Jordan's leadership at the AMC. I'm also deeply honored to share recognition tonight with Alan Alda. Who would have thought that somebody who was such an iconic image in one form in the American mind could become this incredibly powerful and effective voice for simply preserving the human connection in medicine and healthcare. So I have been feeling very uneasy about accepting this honor, and I really wasn't sure why. And then as we took the train up from DC this afternoon, it came to me. And it's because when you're given a recognition like this, it's ostensibly about something you've done. But the only reason I'm standing up here is because of what other people have done for me. And I know everybody in this room knows that in medicine, first and foremost, it's our patients. When I speak with groups of students, I try to impress on them that medicine is so wonderful in part because of the gifts our patients give you. That anatomy lab involves somebody who actually gave their body in death so I could learn about life. That family who, in all my awkwardness, allowed me to be part of delivering their baby, just gave me the gift of sharing one of the most emotional and intimate moments in their lives. And even that dying patient, they provided the gift of helping me understand the key role of empathy and compassion when one requires safe passage out of this life to the next. Those are extraordinary and precious gifts, and they're what enlivens humanism in medicine and healthcare. I also have to say that as exemplified by Jordan, by Dr. Herb Hardis, who's here, there's also the gift of mentorship. Herb, as much as anybody, was the reason I went into psychiatry as a medical student. Even though he's much younger than I am, I knew him when he was department chair and I was a med student at Colorado. That mentorship, again, is unsurpassed, and there are no mentors who've had a greater effect over the last 3 decades on American medicine more than Arnold and Sandra Gold. I've had the gift of working with incredible colleagues. I'm joined tonight by some of the really talented, creative people who really drive the AMC in support of all of academic medicine. Working on a true team is a precious gift indeed. So you may have noticed in the photo of the Gala 2 years ago, then Surgeon General Vivek Murthy spoke to the group. And it was a powerful and interesting talk because he really focused on how the gift of love can be such an animating force for us all in medicine and in life. And I've been given the gift of love by my wife, Deborah, my daughter, Samantha, who was able to join us, my other daughter, Madeline. So thank you for those gifts. They're what makes things so special. 30 years from now, we'll probably have artificial intelligence doing much of the work we do today, but I don't foresee artificial compassion and empathy. Thank you all.